Greetings, my name is Dr Hlongwane-Gukta. I'm a senior anesthesiologist at the Chris Hani Baragwanath Academic Hospital Anaesthesia Department, which is part of Wits University. We're based in Soweto in Johannesburg, and I head up the Wits Anesthesia Wellness Committee. The title of my talk is Creating a Departmental Program to Improve Wellness, but I find the term program a little bit restrictive in its formality, a bit intimidating. And I think initiative is more appropriate. And so my title is Creating a Departmental Initiative to Improve Wellness. I have no disclosures and a few disclaimers. And although I'm not a mental health care professional, I've got an avid interest in wellness. I'm going to talk about why you should bother creating an initiative to improve wellness, what should it look like, and how do you create a wellness initiative practically? So why bother? You should bother because stress is a part of life. Too little of it, and we're bored, and too much, and we get burnout. So you need just the right amount in order to have optimal performance, as Yerkes and Dotson showed in this graphic demonstrated here. But stress left unchecked leads to devastating consequences, of which I dare to add anxiety and substance abuse, and the fact that fatigue actually contributes to the start of stress. Dizanaika and colleagues came up with this graphic, which I think it tells 1,000 words. Our wellness initiatives should aim to intervene at the early part of this stress continuum in order to avoid the devastating consequences. The third reason why you should bother is because as anesthetists, we're a rare commodity and we tend to care for our patients a lot more than we do ourselves, even though we're suffering traumatic events and stresses as we're trying to provide quality health care. And in forming a wellness initiative, there's benefits not just to the individual, but to the organization as well. The individual benefits in that awareness is created and the risks of mental ill health can be reduced. And strategies can then be formulated to promote well-being and support those who need help. In terms of the organization, there's a cost reduction from less absenteeism, from less litigation as a result of labor law breaches, and just a return in investment in those trainees that you've spent years training, and less stress and just morale and well-being will lead to increased productivity. The World Federation of Societies of Anaesthesia formulated this document called Occupational Well-being in Anaesthesiologists, and this is a comprehensive document highlighting what the problem is and why it's important that we bother with wellness initiatives. I'd highly recommend that you read it. So what should a wellness initiative look like? Well, in the wealth of resources that I found, there were two that I wanted to highlight. The first is from the American Psychiatric Association, who formulated this document called A Toolkit for Well-Being Ambassadors. And I quite like the term of the initiator of a wellness initiative being a well-being ambassador. They highlight 3 areas that need to be focused upon. That's the spread of awareness at your institution, the development of a strategic plan for physician well-being, and gaining access to additional resources. They then have this dashboard, which is called the Wellbeing Intervention Continuum, along the one side indicating all the key components of a wellbeing initiative, and then highlighting what specific interventions you can put in place as you go through the various stages of your intervention. So in the preliminary stages, your interventions differ to what you do in the advanced stages. The second is the Long Lives Healthy Workplaces, a toolkit for anesthetic departments. And they start off by highlighting that we want a mentally healthy workplace where there's a shared vision and commitment to well-being, where the work demands are realistic, where we speak openly about mental health and ill health, and there's a culture of respect and inclusivity. Their outline blueprint for your wellness initiative is focusing on 3 prevention strategies, primary, secondary, and tertiary, where the primary prevention strategies are proactive to try and prevent mental ill health and promote well-being. thus reducing individual and environmental risk factors for mental ill health. Your secondary prevention strategies aim to identify risks and problems early and manage the symptoms before they progress. And then the tertiary prevention strategies aim to minimize the impact of diagnosed mental ill health on individuals and on the workplace. And the lovely thing about this blueprint is that this toolkit is that there's very practical suggestions made as to how one then implements these prevention strategies. So in terms of how, the next few slides haven't necessarily followed the toolkits that I've identified, but it's just well-being initiatives and programs that are comprehensive and are doing well in assisting their members. Important to remember that awareness needs to be created at all levels of training, at all levels of clinical practice. The Australia-New Zealand College of Anaesthetists offers a doctor support program in partnership with a professional counselling service, which is comprehensive and available to members 24/7. The Association of Anaesthetists of Great Britain and Ireland does something similar. Both these organizations have comprehensive websites which are wealth of information that their members have access to and highly recommended. In South Africa, Dr. Caroline Lee, the convener of the South African Society of Anaesthetists Wellness Group, in partnership with mental health care professionals listed below, formulated the Healthcare Workers Care Network initiative, where counselling support is available to not just anaesthetists, but all healthcare workers 24/7. And I'm excited to see that colleagues are utilising this, and I hope it grows in strength and in leaps and bounds. In Canada, the team at the University of Saskatchewan went through a very comprehensive 2-year journey of creating a comprehensive wellness program with a curriculum and peer support curricula as well as self-directed learning activities. And I'd highly recommend that you read their journey that they went through. They formulated this dashboard, which is very clear, and I think it would be useful to have something like this available in one's department where everyone can clearly see what the aim is and what is available in terms of resources in the department. At Wits, we're a department of 200 members, 110 of which are registrars or trainees, over 3 main campuses, although there's smaller satellite campuses as well. The problem of mental ill health was highlighted in 2012, at which point the Wits Anaesthesia Impairment Committee, then it was called, was formed, which focused on supporting members, creating awareness and preventing mental ill health. In 2013, registrars started producing a little bit more research into the area of mental well-being, and this confirmed that burnout was a real problem in our institution. In 2014, in attempting to address the problem, we joined an employee assistance program, so a professional counselling service for a year, but found the cost restrictive and poor utilization by our members led to us terminating that engagement after a year. So where are we now? In terms of spreading awareness in our institution, as according to that toolkit for wellbeing ambassadors, we are educating and providing resources, and I commend my academic head, Dr. Mutsabi, for placing wellness firmly in the academic calendar, where regularly wellness topics and lectures and workshops are a regular feature of our institution. And we partner with Dr. Caroline Lee and SASA in terms of sharing resources. In terms of developing and implementing a strategic plan for well-being, we haven't done well in my institution in terms of assessing needs and forming regular surveys, but we regularly engage via email with members to ask what they need. but probably in a reactionary manner, and we could do better on that. In terms of choosing priorities, we've prioritized mentorship and the buddy system. And although more training is needed, these programs are in place. In terms of engaging leadership, we're accountable to, and staying accountable, we're accountable to our management, our executive management team, and report to them on a monthly basis in terms of the various wellness initiatives that are in place in my department. If you look at that wheel that I've created there, our Wellness Anesthesia Committee meets once a month. We've got a partnership with professionals in that, as I've indicated here, to gain access to additional resources, we've partnered with psychologists who we use regularly and requested their permission to display their numbers in our department so that if anyone requires assistance, these are people we've had positive feedback about interacting with. Having said that, in terms of gaining access to additional resources, there's a wealth of information available, and the World Federation of Societies of Anaesthetists has 135 societies as members, which we have access to their websites, and I'd recommend that you do that. But the thing that I wanted to highlight is that the wellness initiative and the core group who drive it are only at the tip of the pyramid that we were dealing with here. I think at the heavy base needs to be individuals who are aware of wellness, aware of where the resources are available, and they then form the foundation of a wellness initiative. We need to emphasize self-care, and I like this the responsibilities of a healthy anaesthetist to oneself, to colleagues, and to knowing the obligations the institution has for it. So I think the problem is too big to be carried and driven by a handful of individuals. Each individual needs to at least take responsibility for their own well-being. But when starting a wellness initiative, there's no need to reinvent the wheel. These two toolkits, there are many others that I highlight, are an excellent starting point. What's important is that we start.